Welcome, class, to the Week 9 presentation for ME 121, Human Anatomy and Physiology. We actually have 3 chapters to focus on this week. I know that seems pretty heavy, but do remember next week is no new content, so you won't have any new chapters to read next week. So kind of get that end in sight and push through, and then you can just focus next week on studying and preparing for your final. So definitely don't slack off this week or next, but do know that the end is in sight in terms of new content to read. So our mission this week are chapters 17, 18, and 19. We're focusing on the urinary system, the reproductive system, as well as what they call the journey's end. It's kind of about aging and just unique features of the body. We are going to go in a little bit different order than what your book does. We're going to start with the reproductive system first. So here we are seeing the female reproductive system. The primary sex organs or gonads of the female reproductive system are the 2 ovaries. And then we see here our layers of the uterus, which is important to know for your quiz. And I'm going to point out some parts to know as well. So the narrow inferior portion of the uterus that opens into the vagina is called the cervix. The uterus is a pear-shaped organ. It incubates the embryo during pregnancy. The middle layer of the uterus, which is the smooth muscle layer, is the myometrium. The endometrium is the inner layer of the uterus, and the endometrium is lined by a mucous membrane. The outer layer is the perimetrium. The part of the uterus that lies above the point where the uterine tubes are attached is called the fundus. And the shedding of that endometrium, or that middle layer or the inner layer lining of the uterus, is called menstruation. We're going to next talk about ovulation. So the menstrual cycle is what stimulates the production of an ovum or an egg each month and prepares the uterus for pregnancy. The process of ovum development is called oogenesis. Each ovary consists mainly of connective tissue through which developing ova are scattered. Each developing ova gives rise to 1 mature ovum and 3 polar bodies. Together, the ovum and its surrounding case make up a follicle. During the pre-ovulation phase of the menstrual cycle, FSH, which is follicle stimulating hormone, stimulates the growth of a few follicles in the ovary. The phase of the menstrual cycle that directly precedes ovulation, that particular phase is called proliferative phase. The release of the mature egg from the ovary is called ovulation. During the post-ovulatory phase of the menstrual cycle, LH, which is luteinizing hormone, stimulates the development of a corpus luteum. So the hormone that's most responsible for ovulation is luteinizing hormone. That's important to know. And luteinizing hormone is said to be at its peak during that ovulation time. Corpus luteum, again, after ovulation, that ruptured follicle is transferred into the hormone secreting structure called that corpus luteum. That's just a general term I want you to remember. If fertilization does occur, which is once the sperm penetrates the egg, the fertilized egg is then called a zygote. And then another term that's going to be good for you to remember is amenorrhea. So that term, if we break it apart, menorrhea is going to mean menstruation, and A is going to be a prefix that means absence. So amenorrhea is the absence of normal menstruation. Let's look at meiosis next. So sex cells are produced via meiosis. And a couple important tidbits for you to remember for your quiz. The daughter cell produced at the end of meiosis has half as many chromosomes as the original. So an example, if the parent cell has 60 chromosomes, then the daughter cells will have 30. In humans, the total number of chromosomes needed is 46. 23 of those are from your mother and 23 are from your father. If not for meiosis, the new cell would have 92 chromosomes. Not what we need. Too few or too many chromosomes could result in cell death. Again, one more reminder of this term I want you to remember is zygote. That term means a fertilized egg. Next, we'll move on to the male reproductive anatomy. So the penis is the male copulatory organ. It delivers sperm into the female reproductive tract during intercourse. The testes are considered the primary genitalia of the male, and I do want you to remember that for your quiz. The scrotum is a skin-covered bag suspending from the groin. The epididymis is a comma-shaped structure that lies along the top and kind of behind the testes. Sperm mature within the epididymis and they're stored there. And then the sperm will leave the epididymis and pass into the vas deferens. Prostate cancer, it's considered a common disorder of men over age 50. Common in terms of a cancer. It's not something that everyone gets. It's not that common. There's a test to check for it. It's called a PSA, protein-specific antigen. It's a blood test. If it's elevated, then there is an opportunity that prostate cancer could be present. A tidbit that your quiz focuses on is a man who has had his prostate removed as a result of prostate cancer would have less viable sperm. So that is important to remember. Moving on to pregnancy. So the placenta is the organ of exchange between the mother and the embryo. Blood rich in oxygen and nutrients is transported from the placenta to the fetus in an umbilical vein within the umbilical cord. The placenta produces the hormone HCG, which signals the corpus luteum to increase in size and release large amounts of estrogens and progesterones. After the second month, the embryo is then referred to as a fetus. There are actually 2 stages of labor. The second stage is when the baby is actually going to be delivered. During the first stage of labor, the cervix becomes dilated to 10 centimeters and effaced to 100%. Next, we're going to move on to our urinary system. So your urinary system consists of 2 kidneys that filter the blood, 2 ureters, and a urinary bladder, as well as a urethra that conveys the waste substances to the outside of the body. The urinary system helps to regulate volume and composition of body fluids. Without functioning kidneys, fluid and ion imbalance would kill you in a matter of days. So this is a very important system. Here we see the kidney. Its main function is to remove metabolic byproducts and waste from blood and produce urine. The correct order for urine to flow through the structures of the kidney is the collecting ducts, the minor calyx, the major calyx, the renal papilla, and then out the kidney to the ureter. The innermost layer of the kidney is called the renal pelvis, and this is actually an expansion of the upper end of the ureter. Next, let's look at the functional unit of the kidney. So the functional unit of the kidney is called the nephron. And here we see the structure of this nephron, and we'll see it a little bit more blown up in the next slide. So a kidney contains 1 million nephrons, each of which consists of a renal corpuscle and a renal tubule. The renal corpuscle, and I'm going to actually go to the next slide because I think you can see it a little bit better. Here we go. So the renal corpuscle is the filtering portion of the nephron. It's made up of a ball of capillaries called the glomerulus and the glomerular capsule that receives the filtrate. The vessels that lead to the glomeruli are the afferent arterioles, and I think you can see those on here. Substances are moved through a filter by differences in pressure across the filter. The glomerular filtrate is chemically most similar to plasma. The renal tubule leads away from the glomerular capsule and first becomes a highly coiled proximal convoluted tubule. So again, that's the first segment of the renal tubules. And then it leads to the nephron loop, both the ascending and descending limbs of it. And then finally to the distal convoluted tubule. Several distal convoluted tubules join to become a collecting duct, which passes through the medulla and it empties into the minor calyx of the papilla. Substances that are reabsorbed and secreted in the ascending loop, this is important to know for your quiz. So in the ascending loop, potassium, sodium, and chloride are reabsorbed and secreted. So if you have a patient that's experiencing an increased urination rate, this could be caused by an increased glomerular filtration rate. It could also be a sign of an overactive bladder. And then new research has actually shown us where the bladder or urination is controlled, and that's actually in the pons of our brain. So urination is actually controlled in the pons of the brain. Moving on, we're going to skip the ureter. The ureter basically is what connects our kidney to our bladder. It's just a tube. There's not a lot to it. So we don't have a slide just on that, but we do on the bladder. So the average bladder holds 50 milliliters before you have the urge to urinate. And urine is discharged from the body through the urethra, which we see at the bottom of the slide here. Some conditions I want you to be aware of. Kidney disease, one thing your quiz focuses on is a risk factor of kidney disease is hypertension. So it's just an important fact of how our body systems relate to one another that hypertension is actually a risk factor for kidney disease. Kidney stones, these can be caused by uric acid, calcium, or kidney infection. Can be quite painful. Sometimes they have to be removed. Sometimes they can be passed on their own. A UTI is an abbreviation for a urinary tract infection. It's often caused by bacteria from feces in the urinary tract. Polycystic kidney disease. This is enlarged cystic kidneys, hypertension, urinary tract infection, dilute urine, liver cyst, pain, hematuria, and aneurysm. Those are all signs and symptoms that could indicate that someone has polycystic kidney disease. Moving into our final chapter for this week, that Journey's End chapter, they talk about forensics. And one way, if you were looking at the bony structure of the male versus the female and all you had was skeletal structures, you could tell the difference between a male and female based on the width of the pelvis. A female has a wider pelvis than a male, and here you can see that demonstrated in the angles. Some tidbits about aging. So the elderly express pain differently sometimes, and sometimes confusion and agitation can actually be signs of pain. Drugs absorb differently in the aging population as well. So the absorption, the excretion, the metabolism can all be affected. And then another tidbit is orange juice in some geriatric patients actually might have a metallic taste. And then almost all of our body systems are affected by the aging process. A couple of things here I want you to remember for your quiz. In terms of the integumentary system, as we age, we get an increase in skin cancer, skin delicacy, meaning our skin is a lot more fragile, and we can develop multiple skin lesions. In terms of the nervous and the musculoskeletal systems, there's a loss of bone density, a loss of neurons, and also a loss of muscle mass. In terms of maintaining wellness, often what we do to our bodies will cause conditions. So if we can just make sure we do the right things at the right time and avoid certain things, we can become healthier people. So carpal tunnel syndrome is one of those conditions that's due to repetitive motion, often in the workplace. And so it's a condition that we can ward off just by simply watching what we're doing. But it does cause damage to the median nerve because the skeletal structure of the wrist is restricted in movement for extended periods. So again, that's carpal tunnel syndrome. Smoking is another thing that we can control. Smoking is the #1 preventable cause of respiratory disease. It leads to damage of the lung tissue and chronic diseases such as bronchitis, emphysema, asthma, as well as lung cancer. So smoking increases occurrence of lung infections and as well as sinus infections. 80% of all lung cancers are traced to smoking. And smoking mothers, if you're pregnant, there's a tendency to have a lower birth weight infant, an increased tendency to premature birth, and also a higher rate of SIDS, which is sudden infant death syndrome. We're going to end with some terms to remember. Forensic science. What that means, it's just the application of science to crime. Kind of a fun little field to explore if you're into that. A lot of popular TV shows now will show a lot of forensic science. Some vitamin things to remember in terms of vitamin C and E. So vitamin C can aid in the absorption of iron. That's another tidbit I want you to know. Vitamin E promotes muscle growth and also may reduce the risk of Parkinson's disease. The use of antibiotic steroids, that's another thing we can control to help with our wellness. They can damage the endocrine system because you are introducing steroids, which are going to affect the hormones and everything else in your body. So again, that leads to our endocrine system. That's the high points of our 3 chapters for this week. Definitely read through the chapters in their entirety and ask questions when needed. I'm always here to help you, so don't ever hesitate. Our information from today's presentation did come from your textbook, so definitely make sure to use that as your #1 resource. Thank you so much for your time. I appreciate it. Have a great week.